Welcome back to ZPTV and our Ask a Specialist series. Today in our studio I have the pleasure to have with me Dr. Michael Polcino. He's a colorectal surgeon. Welcome to the studios.
Thank you.
It's nice to have you here.
I'm excited to be here.
Oh, good. So we have some questions for you today, and I guess getting into your area of specialty, what are maybe some of the guidelines or the age factors that would have a patient coming to your office?
Oftentimes for guidelines, traditionally colorectal cancer was screened with colonoscopies age 50. However, the past several years there's been adjustment. We switched to age 45, and not all societies have switched. Specifically, the American Cancer Society and the American Society of Colorectal Surgeons have recommended screening age 45. And the reason was we found that a lot of cancers were being diagnosed in age 45 and 50. So that's why they decreased the age for screening.
Oh, that's wonderful. That's great news for our audience. I guess, so for a radiology perspective, what would be some exams that you might send a patient to, say, Zwanger-Pesiri?
Oftentimes for myself, I order CTs of the abdomen, pelvis, or MRIs. And really this is for the workup for both colon and rectal cancer. For example, for colon cancer, if we do the colonoscopy, we diagnose cancer, we have to do what's called a metastatic workup. So to make sure the cancer has not spread anywhere. So oftentimes get a CT of the chest, abdomen, pelvis.
Oh, okay.
For rectal cancer is a little bit different. We do get the CT of the chest, abdomen, pelvis. We also order an MRI because that really helps stage the local staging because it determines how we treat the cancer. If we operate first or if we give chemotherapy or radiation first before surgery.
So a few things that I picked up on there was colonoscopies, and so I guess for the viewers and for myself, what would you be screening for in a colonoscopy?
Again, when we do colonoscopies, oftentimes screening for colorectal cancer, we look to see if there are polyps because polyps can develop into cancer. But that's not the only reason we do colonoscopies. Oftentimes, if patients have any symptoms, they have rectal bleeding, if they have a change in their bowel habits, we do a colonoscopy because we can find cancers or polyps. Often there is inflammatory bowel disease, there's some rectal issues which you often find on colonoscopy.
So while it's a pleasure to have you here in the studio, if somebody could do anything in a preventative manner to maybe avoid having to come in sooner than later, what would be some preventative measures you might recommend?
One is, again, oftentimes good healthy living. A good healthy diet, lots of fruits and vegetables, decrease red meat, decrease alcohol consumption, decrease smoking, and really good hydration. Because oftentimes patients come to see me is they have a change in their bowel habits, they're very constipated, and one very simple thing is just increase your water intake.
That's some very easy tips to follow, I would think. So if a patient did want to come and see you, how would they find you, doctor?
My office in Long Island is here in North Babylon. It's 796 Deer Park Avenue, North Babylon. And when I'm not on Long Island, actually, I'm in the Bronx. I'm the director of colorectal surgery at St. Barnabas. I know Zwanger just opened a new center in the Bronx, which I was very excited about.
Absolutely. So not only can you find this wonderful doctor here on Long Island, but check him out in his metro locations along with Zwanger-Pesiri in our Harlem, Great Neck, and the Bronx locations. So we look forward to seeing you. Doctor, thank you very much for coming to meet me today.
Great. Thank you so much.
My pleasure. So again, make sure you're consulting with your primary care provider or your specialist to find out what test is right for you. We look forward to seeing you soon at Zwanger-Pesiri. Take care.